For much of his life, drummer Justin Vigil has known that there was a serious problem with his heart.
I was diagnosed with hypertrophic cardiomyopathy.
A rare type of the inherited disease caused one of the pumping chambers of his heart to not work properly.
Hypertrophic cardiomyopathy, or HCM, is a genetic predisposition to the heart muscle being too thick.
When his implantable defibrillator went off during a gig, Justin knew his heart was failing.
It set me kind of for a loop, and I managed to keep playing through the set.
I remember seeing his last show and wondering if it was going to kill him, because that's how determined he was. He was going to play drums.
And he could, for a while, but over time, symptoms got much, much worse.
I just couldn't walk. I mean, I could not get out of bed.
Doctors in Justin's hometown told him the news.
Your heart is failing, it will get worse, and at some point, this is it. So this is the beginning of the end, basically.
By the time Justin was in his early 20s, he was told his only option was a heart transplant.
We were down to maybe 3 to 6 months he had.
Justin, his mom Mary Beth, and his dad Anthony were not willing to give up on the search for ways to keep Justin's heart beating.
I really believe that, your time is not complete here, that you have a purpose.
Their search for answers took them to Mayo Clinic, to a specialized team led by cardiac surgeon Dr. Hartzell Schaff and cardiologist Dr. Steve Amman.
Here's a young man who has his whole life in front of him, and not only is he symptomatic and shows the symptoms of his heart disease, but he was depressed and discouraged because of the illness and I think the prospects he had at that time.
Dr. Schaff and his team gave Justin another option, to have an operation that was the result of decades of teamwork and research at Mayo Clinic.
Continuity and collaboration and innovation.
The goal is to relieve symptoms caused by the thickening of muscle in the apex of Justin's heart. During the operation, Dr. Schaff opens the small pumping chamber and enlarges it by removing excess muscle tissue. This increases the amount of blood pumped out and lowers pressures inside the heart.
It was just an amazing thing, almost a spiritual thing, literally watching him come back to life.
You didn't just give me back a boy that could sit up in a chair. You gave me back a boy that could drum again.
I want to be an example, and I just want to lead by example. That's my method.
Justin was determined to become strong and healthy. Within a year of his operation, he was back on stage, the leader of his band, Extractus.
I'm coming back, and I'm going to do it in a way that is really big.
For Mayo Clinic News Network, I'm Vivian Williams.